Okay, so I chose my grandma to do the assignment, and she had recent back surgery about 4 months ago, so we're not gonna be able to do certain assignments, but I'm gonna verbalize them. Yeah, so I just wanted to say that before we started the assignment. Okay, so I'm not really sure what you require, but I went with the CP form. So I'm just gonna try to go in order, or just condensate if I'm in a certain area, condensate the trachea and the pulses together, just a little explaining beforehand. Okay, so I want to start already, and 3, 2, 1. Okay, so I'm gonna do hand hygiene beforehand, PPE if it's required, depending the caution. I'm gonna go in and I'm gonna identify my patient with 2 patient identifiers. I'm gonna be translating some parts so she can give me some feedback, because she's dominant Spanish only. Okay. Can I see your wristband? ¿Me permite su esta? Okay. Vamos a pretender que aquí dice su nombre y su nacimiento, ¿verdad? Okay, bueno, dígame su nombre entero y su fecha de nacimiento.
María de Jesús González, de Chapa, fecha de nacimiento 26 de octubre del 50.
Okay, she just gave me her name and date of birth. Okay, ahora sí, terminamos. Now I'm gonna, since I've already identified her, I'm gonna grab all my equipment already. I'm gonna give her some privacy, close the curtains if I have curtains, gonna give her some privacy. Then I'm gonna explain the assignment to her. I'm gonna explain what I'm gonna be doing, the assessment. Tell her ahead if there's gonna be any pain involved, so her anxiety will be decreased. So I'm gonna do it right now in Spanish. Le voy a explicar lo que es esto que le voy a hacer, que van a ser unas pruebas nada más para ver cómo está usted de los oídos, de los ojos, cualquier cosa, con una luz y así. Okay, so we're gonna start with I'm gonna start analyzing her physical appearance. So I can see that she is well groomed. She has no signs of distress. She is calm. Her facial features are symmetric. Her behavior is appropriate for the situation. Her speech is clear. There's no facial drooping involved. Also, her height and weight is appropriate for her age. She is appropriate for her heritage and her age, right? For her height and weight, sorry. Okay, now that that I've already analyzed her appearance, I'm gonna go ahead and tell her if she was able to. Right now, I'm not gonna ask her to stand up because it's kind of hard for her to stand up and down. So I'm just gonna basically do the Romberg test, which is stand up. It's gonna be arms stretched out. She'll stand with feet together and just close her eyes to see her balance. I did the Romberg test, and now I would ask her to walk 4 times. 1 normal to examine her gait, then I will examine her gait and her toes, then I will examine the heels, and then heel to toe. Okay, then that is done. Now I would calculate her BMI, body mass index. Then I'll go ahead and go into examining already her head shape. Lo que voy a hacer, le voy a examinar la cabeza, le voy a tocar tantito la cabeza, nada más para examinar si tiene alguna bolita, algún chipote. Sí, algún chipote, algo así. Así nada más examinarla. Okay, so that's what I'm gonna do. I inspected her head. She is good. She has no lice, so that's why I'm not wearing gloves. I would inspect that. She has no bald spots. The hair is evenly distributed. I'm gonna palpate. Okay. She has no depressions on her head. Her skull seems symmetric. Okay, now I'm gonna go ahead and go down to examining her eyes. Ahora voy a examinar sus ojos. Voy a ver lo que es la parte de afuera y luego lo de adentro, y luego voy a hacer unos exámenes con una lucecita. Okay, so now I'm gonna look at her eyes, look at the outer part, which is gonna be her eyebrows, her eyelashes, her eyelids. Then I'm gonna look at the sclera, the conjunctiva, see the color of the conjunctiva. Look if there's any discharge, any lesions, any cuts. Okay, now that I've examined that, I'm gonna go ahead and let's pretend if that was an eye exam. I would ask her to look at up to what line she's able to see. If she wears glasses, we can see that she wears corrective lenses. Now I'm gonna check for her peripheral vision. Voy a checar su visión periférica. Creo que se dice, ¿no? Bueno,
de los lados.
Sí, de los lados. ¿Se puede quitar los lentes o puede ver así con los lentes? De los lados.
Sí, los lentes con los lentes.
So she's gonna tell me when she sees my fingers. Ok, aquí voy a poner mis brazos y usted me va a decir cuándo empieza a ver los dedos de mis manos, ¿ok?
Ahí.
¿Aquí los ve? ¿Los dos?
Sí.
Ok, pero vea enfrente de mí, aquí véame a mí y me dice cuándo los ve.
Ahí.
Aquí, ok. Okay, so her peripheral vision is intact. Y ahora vamos a checar, we're gonna check now her pupil reaction, and that's gonna be reaction to light, and that's gonna be the cranial nerve 2, and that's gonna be the optic. Well, I already checked the optic nerve with the peripheral vision and the vision test. Now I'm gonna go ahead and do the pupillary reaction, and that's gonna be cranial nerve 3 and 4, and number 3 will be oculomotor, and number 4 will be trochlear motor. Trochlear, just by itself, trochlear. Okay, so first I'm gonna check both, and I will dim the lights, but okay, so we'll pretend we already dimmed the lights, and I'm gonna check for pupillary reaction to light. Okay, voy a checar. Me va a ver a mí directo. I'm asking her to look at me straight. Y le voy a checar nada más así, derecho a mí, no parpadee, va a ser rápido. Voy a checar nada más que se hagan chiquitas sus pupilas. Ok, muy bien. Ok, muy bien. So that's gonna be initial primary reaction. Oh, what was that? Okay, there's a name to that reaction, and then the other one is that I'm gonna check. It's gonna be consensual reaction, when the other pupil constricts even though I'm not applying light to it. Okay. Ahora lo voy a volver a hacer, pero ahora le voy a checar una pupila a ver si se hace chiquita. Okay, it did happen. Okay. Ya se puede poner los lentes si gusta. Now that I've already checked her pupil constriction, now I'm gonna check for pupil accommodation. Now I'm gonna ask her to look at the object close, right here to her, up to 4 to 6 inches, and then I'm gonna ask her to look at the object at that cup that's right there. Okay. Ahora lo que vamos a hacer, vamos a nada más checar la acomodación de la pupila. La pupila que se acomoda, no sé cómo se dice. Y va a ver esto aquí.
¿Con lentes o sin lentes?
Puede con lentes. Va a ver esto aquí y luego va a ver mi camisa. Ok, entonces vea esto y ahora mi camisa. Ahora esto. Ahora mi camisa. Ok. So it was good pupillary accommodation. Now we're gonna go ahead and do the cranial nerve 6 abducens. I'm gonna check the cardinal points, and I'm gonna ask her to follow my pen with only her eyes without moving her head. Okay, I'm gonna be standing 1 foot away from her face. Okay. Ahora le voy a voltear a ver esto, la punta de mi pluma, y voy a, sin mover su cabeza, siga la pluma. Okay. Okay, that was her extraocular movements that I checked. Now I'm gonna do the extraocular movements. Now I'm gonna do the convergence test. So I'm gonna put my pen 1 foot 6 to 8 inches from her face, and then I'm gonna move it forward to see her convergence. Okay. Ahora va a mirar la pluma y la va a seguir con sus ojos y la voy a poner con su nariz, cerquita de su nariz, ¿ok? Okay, muy bien. Okay, moving on. Now we're gonna move on to the ears, right? So I'm gonna check the ears, and I'm gonna go ahead and stand to her side, and I would palpate them. Nada más le voy a tocar los oídos y voy a checarlos adentro con la luz. Okay? So I'm gonna inspect the ears. There's no lesions. There's nothing swollen. So I'm gonna go ahead. I already inspected. So I'm gonna go ahead and palpate if there's any tenderness. Little. No. Okay. So I already palpated. Now I'm gonna go ahead and look into her internal ear canal or external ear canal. Okay. There's a little bit of wax, which is normal. There's no swollenness going on. There's no abnormal discharge. I'm gonna go ahead and check the other ear. Maybe it's a little. No? No. Okay. Okay. So now that I checked the ears, I'm gonna do I'm gonna check for cranial nerve 8. It's gonna be the acoustic nerve, right? Okay, I'm gonna go ahead and stand on her back. Voy a estar atrás de usted. I'm gonna stand about 1 to 2 feet from her, and I'm gonna tell her when she hears, or if she hears my fingers. ¿Puedes cerrar los ojos? ¿Ya? Mm-hmm. Okay, bueno. Tápese este oído con la mano. Okay. Y me va a decir si oye esto. ¿Lo oye?
No.
Otra vez.
No.
¿No oye? Ok, bueno. Ahora vamos a calar el otro. ¿Lo oye?
No.
¿Lo oye?
No.
¿No?
Ah, ¿me lo estás poniendo en el otro oído o qué?
Sí, o sea, sí, se lo estoy poniendo aquí.
No.
¿Lo oye? ¿No? Está bien. Puede decir no, puede decir sí.
No.
No pasa nada. Okay. Okay, so I already checked her cranial nerve 8. Now I'm gonna move on to her nose, right? So first, ahora voy a inspeccionarle la nariz. Si se puede quitar los lentes, por favor. Okay. Now I would look at her nose, look at the outer portion of the nose, external nose. I'm gonna look at the symmetry. Everything is good. Now I'm gonna check for. I'm gonna palpate the nose. We're gonna put our gloves on. Okay, so now that I put my gloves on, I'm gonna palpate her nose. Voy a sentir nada más aquí. Ok, voy a taparle un lado de la nariz. Pongan fuerte la nariz. Y de dentro afuera. Ok. Now I'm occluding one nostril and the other one. Okay. Okay, so I was checking for nose patency. Okay, now I'm gonna check her nostrils, the inner portion, her nasal membrane. Okay, ahora vamos a extender la cabeza un poquito. Le voy a checar con la lámpara. Los mocos. Okay. Okay. So mucous membranes aren't dry, they're moist, they're pink, there's no lesions, there's no abnormal discharge. The nasal septum is intact. Okay, now that we've done that, we're gonna go ahead and do we're gonna test out the cranial nerve 5 and 7, 5 being the trigeminal I don't really know how to pronounce that, trigeminal, and the facial nerve, number 7. Okay, so what I'm gonna ask her to do is gonna be to clench her jaw. Okay, ahora lo que vamos a hacer, le voy a que nada más junte sus dientes así, que se sienta la mandíbula así. Ok, ahora ya puede, nada más así, una rápida. Ok, muy bien. Y ahora lo que vamos a hacer va a ser, I'm gonna ask her to smile, to puff her cheeks, and to scrounge her eyebrows. Ok, ahora va a sonreír, sonríe, ok, infle los cachetes. Ok, y ahora así hágase enojada. Okay, so her facial nerve 7 is intact. Okay, now we're gonna go ahead and go back to the nose to check her olfactory nerve, which that one's gonna be number 1. So number 1, cranial nerve, right? Okay. Ahora lo que vamos a hacer, voy a calar su oído de la nariz, se lo voy a tapar. ¿Con el dedo? Ajá,
¿El dedo?
Sí, el que sea. Okay, so I'm asking her to occlude one nostril and to close her eyes so I can show her the stuff. Okay. Me va a decir lo que huele, ¿ok? ¿Qué es lo que huele?
Canela.
Ok, muy bien. She got it right. It is cinnamon. Y ahora vamos a hacer lo mismo. Tápese el otro hoyo, ¿ok? Y me va a decir lo que es.
Ay, perfume o no sé qué, alcohol.
Ajá, alcohol. Ok, ahora, muy bien. Tápese, cierra los ojos. Tápese otro, el otro. Ahora sí, intercámbielos. Ándale ese. No, el otro. Ok, ¿ahora qué huele?
Alcohol.
Alcohol. Okay. So I was just verifying. Okay. So that's good. Okay, now that I've done her facial, now I'm gonna go ahead and go down to the mouth. Now I'm gonna inspect her mouth. We're gonna use this as a tongue blade. So what I'm gonna do is I'm gonna ask her to open her mouth wide. ¿Puede abrir la boca por mí? Okay, primero nada más le voy a ver de que los dientes, tantito. Puede meter la lengua. Her teeth are straight. She has some white teeth. Okay, now I'm gonna go ahead and test her gloss, the cranial nerve 9 and 10, which is gonna be the glossopharyngeal, and the 10 will be the vagus nerve. Okay, so what I'm gonna do is I'm gonna go further down to her, close to the end of her tongue, and then I'm gonna check for the gag reflex, and then I'm gonna ask for her to swallow. Okay. Okay. Ahora vamos a. Okay. Ahora saque la lengua, diga ah. Ahora sí, muy bien, tiene un reflejo. It worked. Okay. Ahora vamos a hacer levantar tantito y va a pasar saliva. Okay. And so both of her nerves are intact, 9 and 10. We're gonna assess for the hypoglossal nerve, which is gonna be number 11. Okay. Ahora, vamos a abrir la lengua, así normal como estamos abriendo. Y ahora I'm telling her the instructions that she's gonna push her tongue against my tongue blade to the right and to the left to check for the cranial nerve. Okay. Va a poner la lengua de un lado, del lado derecho y del izquierdo, lo que usted quiera, y va a empujar mi de esta con su lengua. Okay. Ahora. Okay, muy bien. Okay, so both worked, it's intact. Now I'm gonna go ahead and move on to the lymph node area. I'm gonna palpate for lymph nodes, if they're swollen, if there's any tenderness, and circular motions. Okay, ahora le voy a checar las linfas. Esto de aquí. Okay.
Mm-hmm.
Okay, ¿le duele o no? Okay, so everything was good. Now I'm gonna go ahead and ask for her to do some movements with her chin, touching her chest, and then both sides of her shoulders, and then ear towards shoulder. Nada más sígame. Ahí va. Barbilla a la de esta, barbilla a este, tocar su hombro, ¿me da cuenta? Así, y luego barbilla al otro lado. Así, como que quiere tocar. Ok, muy bien. Ahora vamos a hacer oído al hombro y luego el otro oído al hombro. Okay, so now I'm gonna check the cranial nerve 11. It's gonna be the spinal accessory. I'm gonna ask for her to shrug against my hands. Shrug her shoulders against my hands. Ok, ahora lo que voy a hacer, voy a poner mis manos aquí, le voy a aplicar un poco de fuerza y usted va a hacer esto para arriba nomás. Ok, va. Ok, muy bien. Okay, and then I'm gonna ask for her to put force against my hand with her cheek. Ahora, va a ser lo mismo, va a ser la izquierda, dependiendo de dónde pongo mi mano. Okay, okay. So, spinal accessory nerve is intact. I'm gonna move on to palpating her carotid pulse, and I'm gonna feel also her trachea and her thyroid gland that is in the midline and that she's able to swallow. All right, I already checked that, but I'm gonna recheck it. I'm gonna ask for her to hyperextend a little bit so I can have a better look at her trachea. Va a hiperextender un poquito el cuello. Okay, lo que voy a sentir su tráquea. Nada más voy a hacer. Okay, now I'm gonna feel her thyroid gland. Okay, su glándula. Okay, ahora puede pasar por mí, saliva. Okay, now she was able to swallow. The thyroid gland is not enlarged. It's at the midline. Okay, everything looks fine. Now I'm gonna palpate for the carotid pulse. Okay, now voy a palparle el pulso del cuello. Ahí va. One by one, so I don't occlude them. Okay, +2. +2. All right. Okay, now I'm gonna go ahead and do. Now I'm gonna I don't need my gloves anymore, so I'm gonna go ahead and I'm gonna check her skin's elasticity, but I don't recall what this is. Okay. Ok, voy a checarle aquí la clavícula, voy a agarrar nada más un poquito de carne y nada más que tal está su colágeno. Bien. Okay, so her skin elasticity was good. Now I'm gonna go ahead and check her upper extremities. I'm gonna check for temperature. I'm gonna check for any cuts, any swollenness, any lumps. I'm gonna check for joint movement in the elbows, in the wrist, and the fingers. Pretty much. So I'm gonna go ahead and do that. Ok, ahora le voy a checar los brazos, que va a ser nada más, lo voy a tocar, le voy a ver el color y así. Ok. Todo al mismo tiempo si quiere para ahora sí. Los dos. Ok. Ajá, así, muy bien. Y ahora así. Ok. Ok, muy bien. Y ahora vamos a now I'm gonna palpate her fingers, I'm palpating her arm. Okay, I'm checking for temperature. I'm checking for movement of the joints. Okay. Palpating temperature and feeling if there's any bruises. Everything fuerza nada más. Okay, muy bien, están iguales. Okay, now that I'm there, I'm gonna check her fingernails. I'm gonna check if there's any clubbing. I'm gonna check if that's the angle of the nail. I'm gonna check the shape and the color, right? And I'm gonna go ahead and check for capillary refill also. Okay, ahora voy a ver sus uñas. Deme las dos uñas. Voy a checar el ángulo. Okay. Okay, ahora vamos a checar. Okay. Okay, ahora voy a voltearle esto para verlo mejor. Okay, muy bien, todo muy bien. Okay, so I already assessed for that. Now I'm gonna go ahead and move on to her posterior thorax. For her posterior thorax, yes, so I would have to switch her position. Let me check. Well, I would, if she didn't have a shirt on, right, I would inspect her thorax. I would inspect her thorax. I'll palpate. I'll look for the muscle mass, for the bones, for any lumps, any tenderness that's going on. So I would look at it and then I would palpate it, right? Entonces me va a decir si siente algún dolor. No lo voy a hacer fuerte. I'm not gonna go hard because for surgery, right? But I'm gonna pretend I'm palpating, right? I'm palpating next to the spine. I have to be real sensitive in that area. Okay. Okay, todo bien, todo bien. Okay, her. Now I would go next to, now that I've already palpated, I will go ahead and check for the tactile firmitas. I don't know how to pronounce that, but I will go to that and I'll go and tell her, no lo voy a pasar, pero nada más, me dice si le duele, okay? Okay, now I'm telling her to say the number 99. Diga 99.
99.
Okay. Ahora diga, ¿puede decir 99?
99.
Okay, good. So that was good. Now we're gonna do lung expansion. So I'm gonna put my hands in T9, T10 above around here, and I will check for her lung expansion. Me dice si le duele, okay? Pues nada más estoy checando cómo se expanden sus pulmones. Respire por la boca. Ahora sí, dale. Okay, that's good. So I've already checked that, the lung expansion, the tactile femoris. Now I'm gonna ask you to, ahora nada más le voy a checar los sonidos de los pulmones atrás, okay? Okay. Okay. Now, since her age, she's an older patient, I'm gonna do not the full onset of the lungs. I'm gonna go ahead and listen to about 4 on the top and then 2 on the side, right? Because we don't want her to run out of breath. Okay. Okay, va a respirar cada vez que le diga dele. Va a inhalar y exhalar por la boca, okay? Okay, ahí va. Dele. Okay, bien. Dele. Okay. Okay. Dele. Okay. Dele. Okay. Dele. Okay. Lungs are clear. Now we're gonna go ahead and put her to, I'm gonna assist her to a supine position so I can go ahead and inspect her precordium area and for jugular vein distension. Now she is in a supine position. Now we're gonna go ahead and look for her. She should be sitting at a 45-degree angle because I'm checking for jugular, sorry. Okay, but since we don't have those kinds of beds, we will pretend that I check for, I'm just gonna ask for her to look to the right. Okay, le voy a poner una almohada atrás, okay? Okay, así. Muy bien. Okay, so I try to put a pillow so she could be a little bit more to the front.
Yeah.
Okay, ahora lo que le voy a va a hacer nada más I'm telling her to look at me so I could check for the neck. Okay, ya está bien. Okay, so she does not have a jugular vein distension. Now we're gonna go ahead and inspect the precordium. I'm gonna check for the aortic, pulmonic, Erb's point, tricuspid, and mitral in order, right? So I'm gonna go ahead and go to the midline of the mid-clavicular line and go down to the second intercostal space. But first, if she didn't have a shirt, I would inspect the precordium, and like to go more in depth, inspect precordium, feel the palpate the aortic, pulmonic, Erb's, and so on, in order also to check and also for the apical pulse to check if I could feel it in the 5th to 6th intercostal space. Okay, but I'm gonna go ahead and auscultate, right? So I just verbalized. Okay. Voy a escucharle su corazón.
Ya no te pones de ladito para que se alcance a ver.
Oh yeah, you can't see.
Ándale.
Así, muy bien. Okay. 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 Respire normal. Normal, así no tiene que para que no se descanse. Ok. Nada, vamos a ir aquí un poquito más acá. Ok. Okay, I was able to hear the apical and the mitral just fine. Well, they're the same, but it was fine. Okay. Now that we've inspected the precordium, I would go ahead and listen to the lung sounds and the anterior thorax. Okay. Well, I would do the same thing: inspect, palpate, and then ask you take the sounds of the lungs. Okay. Ahora voy a escuchar los sonidos de los pulmones. Ahora sí voy a necesitar que
No, voltea al lado. Ok.
Ok. Por la boca. Ok. Normal, normal. Así. Ándale. And then I'm going to go ahead and do these. Okay. Okay. So I was able to hear clear sounds throughout her, throughout the field. Now we're gonna go ahead and go down to her abdomen. I'm gonna inspect the abdomen for any scars, for any lesions, for any lumps that there is, and then I'm gonna auscultate. Then afterwards, I'm gonna go ahead and palpate, and if she was experiencing some pain, I would palpate that area last. But let me go ahead and do that. Starting from the right lower quadrant in a clockwise motion. So I'm gonna go ahead and inspect. She doesn't have any scars. ¿Le hicieron una cesárea? No, ¿verdad?
Sí, sí tengo.
Oh, she has a C-section. She just told me. So now I will take that into account. She doesn't have any. I don't see any lumps. I don't see any redness. The temperature is fine. Okay. Now I will go ahead and auscultate. It's starting from the right lower quadrant, right here. No le duele el estómago ni nada, ¿verdad? Okay. Okay, I am hearing some gurgles and clicks. Okay. Now I would palpate 1 to 2 centimeters in a clockwise motion, also starting from the right lower quadrant and just moving up. Me dice si le duele algo, okay? Okay. Ok, ya se puede escribir. ¿Quiere? Ahora sí. Okay, now that we're done with auscultating the abdomen part, I will go ahead and move on to the femoral pulses. I'm gonna identify them with my, palpate them first, and then I would auscultate them. Put this over here. Okay, ahora voy a irme a los pulsos femorales que van a estar encontrados en esta parte. Okay, ahora los voy a tocar. Okay. Okay. Now I would ask you to take them. +2. All her pulses have been +2. Okay. 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 Okay, now I'm gonna go ahead and move on to her lower extremities. Ahora vamos a mover a sus piernas. So, just a heads up, she has decreased mobility on her legs due to the surgery, so I would just verbalize if I'm not able to, if she's not able to.
Okay. Para arriba, para abajo, para donde.
Ahora primero first I'm gonna inspect her legs, right? Vamos a inspeccionar sus piernas primero, ¿verdad? Vamos a mover tantito aquí, vamos tantito acá. Okay. So I'm looking at her legs. She has some scars, maybe because she fell when she was little. She does have some varicosities. She has right now no hair. She doesn't have any bruises, right? So everything is fine so far. Now we're gonna go ahead and do pulses. We're gonna check for edema first, right? There is no edema present that I see, but I'm gonna go ahead and check in the pretibial part and in the dorsal part of the foot. Okay, so I'm gonna go ahead and put the finger. Okay, there's no pitting edema, there's no edema. And I would take off her socks, but I'm not gonna do that because it's a little bit hard for her to put on. So just to save up time, I would check for pitting edema here, 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 right? Okay. So now that I've checked for edema, I'll go ahead and check for pulses, right? So I would check the pulse, the tibialis pulse. I don't know if that's called tibial pulse. Right here, voy a checar por su pulso de aquí, ¿ok? Me dice si le duele.
Y me dice si lo sientes.
Sí, sí lo siento. So I was able to feel it. Okay, so everything is fine. After feeling her pulses, now I'm gonna go ahead and check. I will feel her pulse right here. Okay. Now I'm gonna check her popliteal pulse over here. Ahora vamos a ir a la rodilla, pero nada más voy a checar atrás el pulso. Me dice duele cualquier cosa. Okay. Okay. Now I'm gonna go ahead and check for the straight leg test. Okay. Vamos a levantar la pierna hasta donde usted pueda, ¿ok? Derecha.
¿Cuál?
La que sea, la que usted quiera. La que se le haga más fácil. Okay, she can do it by herself. Okay, ahora sí. Alright, ahora la otra. Despacito. Ay, pero es bonita. Alright, I wasn't expecting that. Ahora sí, bájala. Despacito. Ahora vamos a doblarla. Vamos a doblarla así, nada más así, arrastrarla, no me tiene que levantar.
¿Así?
Ajá, sí. So we're checking for her joint mobility here. Now we're gonna go ahead and, ahora sí, derecha, la otra, lo mismo, ok, derecha. Ok, muy bien. Ahora lo que vamos a hacer va doblar esto. Now what we're gonna do, I'm gonna check for her dorsiflexion and plantar flexion. Okay, voy a poner contra mis manos, dele. Ok, muy bien. Ahora, derecha, así normales. Contra mis manos. Ahora sí. Okay, that's good. So she was able to dorsiflex and plantar flex, weight, super easy. Now we're gonna go ahead and check for the deep tendon reflex, I believe. And vamos a checar por al pie, de que se le tiene que decir que sentir rarito. Ahí va. Te relájalo, el pie. Ok, este.
Siento más porque se me
Sí?
duele más.
Okay. Okay, so we already checked that. And if she was a bed rest patient, which she is not, she used to be, I would check her bony prominences, which will be the heel, her sacral region, and just check for mobility and assist with some positioning. And then if I was in a hospital setting, I would just make sure that she's at a comfortable position before I leave. If there's anything that she needs before I leave, I would also check that the collar belt is within reach, the over table is within reach, and the 3 side rails are up. And that's pretty much it. Thank you.